Welcome to your Practice Multiplier. We begin each day with proven strategies to increase the success of your dental practice. Now, here are your hosts, Dr. Teresa Cody and Dr. Tim Cashin.
Welcome back to your Practice Multiplier. These small changes will really have a huge impact. We know because we've done it. So let's talk about hygiene. This is a little harder.
Yeah. So yesterday or in the last video, we talked about concerns on the doctor side, but today we're going to talk about some concerns on the hygiene side. Now, for years, how did we dismiss the patient in hygiene?
Well, we said, looks good, Tom. We'll see you in 6 months.
So ask yourself, does that create value for the patient to really encourage them to keep their appointment next time? I think if you're really honest, your answer is no.
Right. And you have those patients, they come in very dutifully every 6 months, but then you have others, I didn't know it had been a year, 2 years.
Right.
Life goes on. Life is quick. 6 months comes around fast. So we did 2 small changes here.
Well, let's start with an easier one. Let's say it's a new patient that comes in with perio, all right? And let's say that the next appointment is to do some SRP, right? So, a concern here would be certainly to tell the patient that, we're very concerned, Dr. Cashin's very concerned about the health of your gums, so it's so important that we see you next time so that we can make sure that your gums stay healthy. That's a little bit of an easier one.
I'll tell you what's harder. What's harder is a concern when there's no treatment to be done and really the next appointment is a regular hygiene appointment. But you can ask any hygienist. There are things. There's buildup of tartar, there's staining, there's a perio pocket. So the one trap our staff fell into was the only concern is just hygiene.
Right.
That's not a concern.
Yeah, and let me say something here is that, we all know in our practice the patients that just methodically keep their appointment, right? But you also know the ones that tend to miss. And so it's really critical here that for those patients that you really tell them in a way that you are concerned.
Right.
I mean, this is another example of a small change can make a big difference.
Well, and you say that Tracy, your hygienist, Tracy, is concerned with the amount of stain and buildup. So we need to see Sally exactly on time in 6 months. Now that's the next change.
Yes. So we have found this is something that's not difficult to do. This is a small change that made a big difference. So what do we say in our office now instead of, we'll see you in 6 months? We
name the month that they're due.
Right.
And that way, that puts that in the patient's
It really
brain.
is psychological.
Right.
To say it's so important that we see you next July as opposed to
6 months.
To 6 months. So again, that's a really powerful small change that can make a big difference.
Okay, so now we want you to commit to coming up with concerns and naming a concern for every single patient that you check out. Every single one.
And so to kind of wrap up this topic, what we'll do on our next video is we'll kind of put things together and give you some more everyday examples of how we do this in our office. We'll see you next time.
Thanks for joining us on your Practice Multiplier. We're here for your success. Have a productive day.